Welcome to today's webinar, Breaking the Silence and Addressing the Mental Health Crisis Among Men. My name's Lindsay, and I'll be your moderator for this webinar. In this session, we're going to cover why men's mental health should matter to everyone. And we're going to back it up with key stats, discuss cultural factors at play, and introduce ways to offer support to the men in your life. We're very excited to have two experts with us. We have Natalia and Jason. Just a little bit about your speakers. So prior to Tava, Natalia worked as a clinical therapy team manager at Cerebral and as a therapist at AtlantiCare. Jason brings over 2 decades of experience as a licensed clinical social worker, who's currently at his private practice. He combines aspects of acceptance and commitment therapy, cognitive behavioral therapy, and narrative therapy to help individuals, couples, families navigate challenges with compassion and practical tools that create lasting change. Welcome to both of our speakers. We're so glad to have you. So that's all from me. I'm going to hand it off. Natalia, it's all you.
Yeah, thank you, Lindsay. And hello, everyone, again. Thank you so much for joining us today. Like Lindsay said, my name is Natalia Andreev. My role is a clinical operations manager at Tava Health, but I'm also a licensed clinician. And I'm literally so thrilled to be participating in this very important conversation on men's mental health. And I think this topic is not only important to men, but I think it's really important to all of us. And I have such an honor to have Jason here, who is a licensed therapist, and he's going to bring his firsthand clinical experience, but also a lot of personal insights and the unique challenges that men face when it comes to their mental health. And like Lindsay already mentioned, we do have a pretty abundant and just start off, our webinar is titled Breaking the Silence, Addressing the Mental Health Crisis Among Men and How We Can Help. And during our webinar today, we hope really shed some light on this very important growing health crisis in men, but also going to what to be updated and what we can do about this. And of course, we're going to share some that you can support men in your life, whether you are a partner, parent, colleague, friend. But I also wanted to kind of start with saying that this topic and this conversation may bring up some deep emotions, some personal reflections for some of us, and also that's okay. It's a part of the process, and we want to ensure that this space is safe, and this is the space of support and the space of learning. We're also hoping to make this conversation very interactive because we do love hearing from you. We want to hear your perspective. We want to hear your opinions. So we are going to take some polls throughout the presentation. And here we have the instructions on how to join the poll. In my opinion, it's easiest to join by sending a text. You can send my name, Natalia Andreev, no spaces, to the number 22333. And you will receive a confirmation text and you can participate in the activity that way. Or you can also go into your browser, type in polleb.com, enter my name again, and you can respond to the activity in that way. Again, I'm going to keep this slide up for just another couple seconds. I think Lindsay is going to drop the instructions in the chat for those of you who might need, again, just a couple more minutes to join. And for those of you who are not able to join, just a reminder, the chat is open, the Q&A is open. You can always participate in any of the poll activities that way, and Lindsay is going to help us moderate it. Okay, so I hope everybody was successful in joining our polling tool. So let's not delay it. Let's try this out. With maybe one or just a few words, let us know what comes to your mind when you hear, men's mental health specifically. Okay, don't show feelings. Okay, stigma. Absolutely. Jason, what comes to your mind?
Male ego.
Male ego. That's a good one.
That's the thing that comes to my mind when I hear about this.
Men's
That
mental
and
health.
confusion.
Well, okay. Well, I think we're going to talk about the confusion, right? So you had a very important thought to share, but we also have lonely and crisis and suffering in silence, toughen up. Oh, we have a whole section on toughening up.
Yes, we do.
They should take care of, I guess, everything. strong, then strong, shame, overlooked, weakness. Absolutely. Well, you guys, maybe you can just participate, facilitate this webinar. It looks like people already know what this is all about. Absolutely. Being strong, that's the cultural message we're going to dissect. And, people hear often hated on. Boys don't cry. Yes.
Yeah, it's a big one. That is a big
Yeah,
one.
the stigma of being a successful and strong man. We're going to talk about the man box and the expectations from our society. Pick yourself up. Yeah. Or don't you dare to even fall. Boys don't cry. Yeah. The men need support too. Absolutely. Everybody needs support. If you're human, you do. Um, Avoidance, reluctance. Oh, we have a pretty engaging group here. So thank you so much for being so engaged. Reluctance. We're going to talk about why men don't seek help. Toxic masculinity. Yes, absolutely. They're human too. Would you agree, Jason?
For most part, yeah, we are.
Yeah. So great. Again, I really, really appreciate the engagement, the vulnerability for being open. Again, these polls are completely anonymous. We welcome everybody's opinions. Everybody's thoughts are valuable because that's what allows the diversity of thought and just makes this presentation so much more interesting. But we're going to start with just kind of like grounding ourselves in some facts and some statistics and to see that men's mental health challenges are really widespread, even though sometimes they might be pretty hidden. But before we go over some of these numbers specific to men, I wanted us to zoom out. And I know, Jason, you probably are very familiar with this statistic already. But if we look at the general population, we do know that the prevalence of mental health challenges is about 20%, right? Or it makes it 1 in every 5 US adults will experience some kind of mental health challenge or condition in any given year. And if you take and translate it into numbers, right? So it would be about over 50 million people. So it's a lot of people who are struggling in general. But when we look more closely to the numbers specific to men, we definitely start seeing a pretty troubling pattern. Not only men are affected, that many of you already noted, but they're also struggling in silence. And how is that so? For example, when it comes to the suicide rate, we know that the suicide rate for men is about 4 times higher than it is for women. And when it comes to, completed suicide, men actually make up about 75% of all suicide deaths in the US. And what does it tell you? That men often wait until this breaking point before they even maybe attempt or think about seeking help. And even though it kind of says, the research says that 1 in 10 men experiences depression or anxiety, this is definitely not an accurate number because many men often go undiagnosed because the symptoms either don't look like the ones we expect them to look. For example, when it comes to depression, and they may not seek care, or there is this huge barriers to men seeking care, like people mentioned reluctance and the cultural messages surrounding what it means to be a man. So I'm sure if we, you know, um, account for every man who have struggled with a mental health challenge, it's probably going to be closer to the general population, maybe even higher. So, and when it comes to actually seeking help and seeking support, only about 25% of men who are struggling are going to seek professional help. What does that also mean? That means that the majority of men are dealing with their pain alone without any support, any sort of intervention. And if you compare this statistic to the general population again, in the general population, the prevalence is about 20%, but about half or 47% of those people actually receive some kind of mental health service or support. When it comes to men, it's less than a quarter. So anytime I personally look at the numbers, they're just so shocking. They're so truly eye-opening. And not only do they reflect that we have a mental health crisis among men, but I think they also reflect that we have somewhat of a cultural crisis, right? Where we have a lot of stigma, where we have silence, where we have a bunch of outdated beliefs about masculinity. And that kind of, again, keeps men away from getting the help they need. Do you have anything to add here, Jason,
But
when it
it
comes
is
to
true.
numbers?
A lot of it's interesting that a lot of the men that I have been able to get come in, they will often say, right, I've been thinking about this for years, but never really did it until now. And so there's this idea of, I'm going to hold off. I want to hold off to see how long I can go.
Yeah. Absolutely. So again, we do see these numbers are showing that men are struggling and they're not getting the help that they so desperately need. But that also doesn't mean that they are not coping with it, right? So again, I
Mhm.
think a lot of men are coping in ways that might not be immediately recognizable as signs of distress, right? They might be coping through, I don't know, deflection, overworking, withdrawing, turning to substances, which a lot of times in our line of work as clinicians could be those silent indicators or silent signals that something much deeper is going on. But we are going to try another poll here. So if you take maybe a moment to reflect on what this looks like in real life, right? So maybe do like a sweep of your surroundings, of the people, of the men in your personal professional life. Which coping strategy do you think you've encountered or as a man use more often to cope with mental health challenges? Yeah, I have some answers rolling in. Substance use, relying on substances. Yeah, so we have overworking. Jason, what is your go-to? What are some of the clients maybe share as their go-to coping strategy?
The ones that I see the most, substance use is very big, especially amongst men. Um, I'm surprised because overworking, I see that a bit, but I think there's a reason why people don't think about that as much, and I'll go into that a little bit later. The emotional withdrawal, it's interesting because what some people would call as an emotional withdrawal, it's men not knowing what to do, so they protect themselves. They're not on purpose trying to withdraw or anything. Uh, I'm surprised that nobody has chosen healthy outlets.
I was going to comment on that as well, right? So very surprising because all of the strategies, while they can be pretty effective in the moment, right? They can provide the immediate relief if you are feeling really pressured. They're definitely very unhealthy in the long term, right? And not going to
Mhm.
do any good to people. But yes, nobody is observing healthy outlets or actually using those healthy outlets as their coping tool. All right, well, I do think that your responses here definitely reflect something really important, right? So men are coping in some way, but those strategies are not healthy and oftentimes maybe they're very harmful. So on the next slide, we are going to look at, I would say, some of the most common ways men manage their emotional pain. And it would be isolation, substance use, and emotional suppression, right? So again, that's kind of tends to be the consensus among the group in a previous poll. But when it comes to, for example, isolation, recent surveys are actually showing that men these days, younger generations, are more socially disconnected than ever, with 15% reporting that they have no close friendships at all. And we know that social connection is really good for your overall health, not just mental health, but even for your physical health. And being emotionally disconnected, not having those healthy relationship with people, close relationship with people, could result in pretty significant physical and mental health consequences as well. My favorite phrase when it comes to social connection is "no man is an island." It's the opening phrase, I guess, the line of the poem written by a 19th century English poet. And I love this because it does demonstrate that we are not isolated islands. We are a part of something bigger. And when we don't have, and we don't feel like we have that, men don't feel like they don't have that. They feel socially disconnected. And then substance abuse is another big one. And that's what you said, Jason, right? That you encounter very often in your clients. Yeah. So again, the research shows that men are as twice as likely to binge drink compared to women, and they're more than twice as likely to meet the criteria for an actual substance abuse disorder. And a lot of people would say, well, it's, willpower, but I don't think it's about the willpower here. I think it's about, and oftentimes, and you could probably back me up, unresolved pain or lack of healthy outlets or, just cultural messages in general that discourage vulnerability and emotional expression.
Yeah, that's what I see a lot. When I do have clients that come in, usually men that come in saying, I need help with my alcoholism. I need help with my drug use. Um, as soon as you start kind of getting into it, you start going like, okay, so while your substance use is an issue, there's something driving it behind, and maybe we can start looking at that. And back on the isolation, I think it's interesting because a lot of changes that have happened since 2020 and COVID have made it easier for us to isolate. And so we've lost a lot of the natural built-in ways to interact with people. A lot of young men that I work with, when I ask them about their friends, they will say, "Oh yeah, I've got good friends." And yet when you say, "Well, what do you do when you spend time with them?" It's usually, "Well, I'm online playing games." And it's like, okay, so wait, where are these friends? Oh yeah, I live in California. They're in Kansas and Jersey and Ohio, and it's kind of like, okay, so they are starting to think of that as a connection, but in reality, it's not. And so that's one of the big things that I'm seeing in the younger generation as they come up.
Yeah, and definitely, I think that's the whole definition of connection has been shifting as technology evolves, and definitely the COVID-19 played such a huge role in it. But yeah, that's an interesting point that you're sharing. Absolutely, and I also think that in general, when men lack healthy outlets for emotional expression, that's when they turn to distraction, right? So whether it's through overworking or alcohol, using drugs, or even humor, right? Joking around to mask the pain and what's really going on. Again, it could be helpful in a moment for a very brief period of time, but then it also comes at this huge cost where emotional suppression we know is associated with, again, high rates of suicide, substance abuse, depression, anxiety, and the list goes on and on, up to even like the physical illnesses that sometimes could be present. And I think these problems are not individual problems. When men struggle in silence, it doesn't just affect them, right? So I think it affects everybody around them. So if we look
Mhm.
at the families and their relationships, we know that unaddressed mental health issues can lead to disconnection, not healthy relationships, emotional absence, or even I think sometimes can lead to trauma that can be passed down through generations. Now, that's in personal life. If we look at the workplaces, we can see this in burnout, loss of productivity, turnover rates, just the ability to complete the tasks, being even like also forming a healthy relationship with their coworkers and their colleagues, right? So especially when they hesitant to seek support or the mental health resources are just not readily available. So that's a workplace, but also if we again zoom out and look at the communities at large, again, substance abuse, violence, disconnection, again, often comes from the pain that's been gone untreated for years. And it affects anything from the nuclear family to a wider community circle. So I think when we talk about supporting men, it's not about mental health. Men's mental health is not just men's issue. I think it's just in general a human issue. Okay. Well, uh, Lindsay, if there are any questions or comments in the chat, would be a great time to address them. If not, we're just going to keep moving.
Beautiful. We haven't gotten any questions yet, but this is a great reminder. Folks, get your questions in the chat or Q&A.
Awesome. Thank you. So again, we've looked at the numbers, we looked at the scale, we looked at the impact of mental health crisis among men. And I think that kind of begs the questions, why aren't men getting help? I wish Jason and I had a pretty straightforward answer, but we don't. I don't think it's simple. I think it is shaped by culture in general, by a man's upbringing, by the stigma, which is so, so huge. And even I think it is shaped by the way our healthcare system, our mental health care systems are designed. And to truly support men, I think we need to move beyond just understanding the symptoms, which is also very important to recognize, but we also need to look at the barriers that keep so many men from seeking care in the first place. So let's take a look as to why men's mental health issues often go undiagnosed. Again, I think unlike the stereotypical symptoms of depression, right, that we commonly observe maybe in females, men often present with different set of symptoms, and it could be anger, could be irritability, could be social withdrawals, and oftentimes these manifestations can be, I think, not only misleading, but sometimes they could be mistaken for personality traits rather than the indicators of mental illness, right? So he's just angry, or he's just a grump, he's just always irritable. Again, assigning those symptoms to being ingrained parts of their personality instead of saying, maybe it is an indicator that a person is struggling with something. Is that something that you encounter, Jason, in your practice?
Very much so. I've had a lot of men that come in and they say that they've been um, told, you have anger management issues, and so they're assigned to anger management, and basically what that's doing is it's teaching you even further to not feel. You need to take this anger and kind of calm it down and find a different outlet. When with a lot of men, what they're doing is they're struggling with some of that is the depression, the anxiety, but they don't know how to express it because they've never learned.
Yeah, absolutely. And I also think that additionally, men tend to report a lot of physical symptoms, right? Such as feeling fatigued, feeling tired, or maybe having sleep disturbances without necessarily recognizing that all of those things, those somatic complaints actually come from, have some emotional underpinnings to them, right? And when men are so focused on their somatic presentations, right? Their symptoms. I'm not sleeping well. My appetite is, disturbed. I am constantly feeling tired. I think it also sort of leads, clinicians or even medical doctors to go in a different directions. They're going to look for a physical cause of their symptoms instead of probing deeper into the potential mental health concerns. Sounds correct. Yeah. So do you see that as well?
Yeah. One of those things that we see a lot more too is, men will say, "I don't have the motivation that I used to," and we're seeing a big push now for testosterone injections and things like that. And while I acknowledge that testosterone can be it's a low T thing and stuff like that, that a lot of these men, what is going on is just this. There's unresolved things that if you start kind of taking care of those, all of a sudden they start feeling better and they start finding that motivation again. And so it's we see a lot where people are, well, I'm dealing with this, and so doctors will be, well, let's do this medically instead of a mental health search.
Yeah, absolutely. And I always think that if you are experiencing actually physical symptoms, by all means, I always encourage men or just people in general to check in with their primary care doctor, because we do want to rule out any medical causes of your symptoms. But if you went to the doctor, maybe they ran some labs and they did their checkup and you were given a clean bill of health and saying, you know what, physically, nothing seems to be wrong with you. So I guess that could be that little bell saying, okay, well, maybe I need to look in a slightly different direction. And I also think that we have compounding the issue here that we're going to talk more about the societal norms and the stigma around masculinity that discourages men from seeking help. But I also think that the fear of appearing weak or being vulnerable results in delayed treatment, right? So them delaying seeking that help until the situation kind of reaches the crisis point, and then we are dealing with a true crisis, right? And that sadly could lead to a very, very sad outcome, such as an attempted suicide or an actual suicide. So I do think that it's really important to anybody, healthcare providers, mental health care providers, or anybody who is trying to be a support to a man, to recognize that men do tend to present pretty uniquely when it comes to symptoms, and definitely encourage those open, non-judgmental conversations around mental health. And I also, again, just kind of going back that we often overlook when men are starting to cope, right? Maybe they just increasing their substance use a little bit through self-medication. Or maybe it's just them starting to engage in risky behaviors. Again, we don't want to label them as just rather bad habits or midlife crisis. We have a lot of terms that we use for those behaviors, but maybe approach them from the point of curiosity and say, hey, maybe these are actually the signs of deeper, emotional pain, emotional distress. Yeah. So
There's
rings
also
true.
one thing I want to add to the self-medication part that does get overlooked, especially in men, and that is some of those healthy coping things that we talked about, right? Going to the gym and, things like that. I I have worked with men where that is their escape. And while going to the gym, people will say, "Hey, that's great, you're getting in shape." But what they're doing is they're doing that at the risk of being away from their family and causing strain in that familial relationship, and things like that, or overworking, right? Oh man, I'm putting in 90 hours a week. And people will look at that and often praise those behaviors, not realizing, hey, this is a sign of something.
Yeah, I think it's a good point, right? Not only can we label them as bad habits, but we can also not recognize those behaviors as a sign of, again, a deeper concern and just encourage them so the man will continue engaging in those behaviors. Right. But again, we are going to talk a lot more about culture and the cultural messages. But I invite everybody to just think for a moment about maybe, your current situation or about when you were growing up. And what does it mean for you when it says you need to be a man? And I think oftentimes the messages that'll come to mind are the messages that shape how men respond to stress, how they, respond to their emotions, what they do with their emotions, how they address mental health challenges. And a lot of times they recognize it and a lot of times they don't, and us as well. So I really want us to maybe take a moment and to choose one of the fallen phrases maybe that you've heard yourself as a man, or maybe you've intentionally or unintentionally used in a conversation that discouraged openness in men. Yeah, looks like men up is boys don't cry. Yeah, I think we had this in our very first poll as well. Yeah, we're going to have some um, thoughts shared in the chat, but looks like boys don't cry and men up are the take, the top two spots. Be a real man. Jason,
Yeah,
is there one that kind of you can relate to, or maybe you heard a lot growing up, or even here up to this date?
the one that happens a lot is big boys don't cry. It's that, from it's interesting from a very young age, we begin to treat boys this way, right? A little boy's running along, he stumbles, scrapes his knee a little bit, and we'll say, "Oh, it's okay, tough it up, big boys don't cry." And so from a very early age, we start teaching in this. It's like you need to do that. And then as you get older, what happens is now we start going into the social arena where now we have peers that will sit there and say, "Oh yeah, if you cry, that's a sign of a weakness, or that means that you're not a real man." And it kind of continues, and that gets taught as we continue to learn, grow. From it starts out with those closest to us, and then in our social arena. And so that is
Yeah.
one that I've heard a lot. As a matter of fact, just the other day I was talking with somebody and a client, and they were saying that they had had a really hard discussion with their wife, and it kind of made them sad. And they were kind of just, hmm. And their wife was like, "Why are you angry?" And they said, "I'm not angry, I'm sad." And their wife said, "No, you're angry." And wouldn't allow him to cry, right? Wouldn't allow him to have that emotion. And that falls into this idea of, boys don't cry, you don't feel sorrow, you don't feel sadness.
Yeah, and I think a lot of times, even as female counterparts, we don't know, if that's the cultural messages that we also keep hearing growing up and then reinforced by the society. A lot of times, people don't know how to support a man, right? So when a man actually gets to a place where they want to be vulnerable and open up, a lot of people are like, "Well, now I don't know what to do with this."
Mhm.
Yeah, but I do think that this is again we have Men Up takes the gold medal, and then Boys Don't Cry, and followed by a few other messages that we heard. So we are going to also kind of review a few very powerful and often not very visible, they're often quite invisible forces that shape how men experience and respond to mental health struggles. So, of course, stigma, right? So I think, Jason, you said that again, many men are just afraid of being judged by their peers, by the employers, but also by their family members, people who are, the closest to them. So again, and they have this pervasive belief that asking for help is a sign of weakness. And then, I think another layer would be that people internalize this. They feel shameful, and that shows up as the internal message. I should be able to handle this on my own. I should be able to
Yeah.
handle it by myself. And then it directly ties into this idea of stoicism. I know, like you said, from a very young age, we're teaching our boys, whether it's directly and sometimes it happens indirectly as well, that when it comes to emotional expression, right, it is not safe. It is not often welcome. It's not masculine in that sense of masculinity. And vulnerability is something that needs to be suppressed and not welcomed or shared. And I think because emotional habits, like many other habits, are formed so early in life, then they do carry into the adulthood.
Yeah. Well, and they get developed in a young age, and that's where we're most vulnerable and malleable and being shaped, finding out who we are. And so it's interesting with the fear of judgment by peers, employers, or others. There's an internal fear of not, we judge ourselves where, I don't, the statement is man up. And it's like, well, but what does that mean? And that's where, for me, the male ego comes in. And the male ego is just this idealistic version of what a man is. And I don't think any of us will ever live up to whatever we create in our mind. And so we judge ourselves based on this. And so that's another thing that happens. But we can't say anything, we can't do anything. With the stoicism, it's funny. I will talk to men and when we talk about emotions, I'll say, okay, as I understand it, men are kind of taught two emotions. You can be angry, and that's the emotion that we don't like as much, but we'll let you have it, or happy. And most men will look at me and they'll go like, yeah, other
Yeah.
than that, what else are we supposed to do? And so
Yeah.
that's where a lot of that stoicism comes is, yeah, you've got to fit in this little box.
Yeah. And we're going to talk about the man box too. But yes, all those cultural messages that we just saw in a poll in the previous slide, I think here's the thing though, those messages, this kind of mindset doesn't necessarily just stay inside the culture as a broad term, right? So then they seep into your relationships, into your workplaces, and then, like you said, your inner voice, your inner man's voice, or your ego, right? So again, I think if these messages go unchallenged, that's when we see the denial, the emotional shutdown, then men being accused of being emotionally unavailable, or again, men waiting until things get to like the breaking point before they like even contemplate the idea of seeking some kind of support.
It's funny because I tell people, from a young age, we're taught big boys don't cry, don't feel, don't feel. And then you hit the age of adolescence. And for men, this is where, for most of us, we start finding interest in relationships. And when it's in a relationship with a woman who's been taught how to have all these things, this is where it's interesting because you start going out on dates, and then women are like, how come you never share with me? How come you never tell me how you're feeling? And guys are sitting here going like, because I'm not sure what the heck I'm supposed to say. I don't know. And that's the kind of the first instance for a lot of young men where they're going, I'm starting to get a little confused.
Yeah, absolutely. I think that's just such a valuable point. But I also think our next slide, even when men are ready to get support, oftentimes we don't have the systems that were designed to meet them where they're at, right? So again, it's sad to acknowledge that even mental health services, even though we've come a long way, but oftentimes they were not designed with men in mind, right? So many therapy models, and Jason, again, you can probably speak to it as well, they rely on pretty heavy emotional disclosure and pretty much right away. And again, this could be a very huge barrier for men because they haven't been given the tools or sometimes even the permission to emotionally disclose. So they don't know how. So you think, okay, I have this therapy that I can go to, but they're gonna make me sit there and talk about my feelings. This is scary. I don't know how to do that. Never done this before, or I was even maybe punished for sharing a feeling. So I don't think this is for me. Again,
Mhm.
that sometimes they have this service available, but they're not going to use that service. And I guess it also ties a little bit into that therapy space. Mental health therapy is still pretty much female dominated field when it comes to therapists. We do have a lot less male therapists, and when it comes to finding somebody who will represent you culturally, so a therapist from a diverse cultural background, that becomes even harder. So again, this is sort of an unintentional way of the system excluding men from seeking care that they need. And so again, we do have a few other points here where, again, there is this mismatch that we need to talk about and maybe take some corrective actions on actually saying, yes, please seek help, but also make sure that the system that is providing help is designed to meet that man where they're at. And there's definitely a lot more opportunities that could be implemented in a society, right? In schools, in our workplaces, and even when the primary care doctors talk to men, maybe during their regular annual checkup, again, to look out for the signs of mental health struggle, specifically in men. Okay, so we've talked about cultural messages, and I do really want to spend a little more time to dig a little deeper. I think we just scratched the surface with these messages, and I do want us to examine the masculinity trap a little bit more. And I love this quote by Dr. Wei, who said, "We raise boys to not feel, and men are shocked when men can't connect." I think this ties into your example, Jason, where that's what we tell the boys, and then they meet a girl and they go out on a date, and then there is this huge divide into how they are trying to connect emotionally. And I know that a lot of researchers these days and a lot of advocates are looking into and exploring the paradox that is called the man box. And if we define that, it's sort of like, I think, a set of very rigid expectations about what it means to be a man, right? So think about the man box, and at its core, I think it is referring to something that is very narrow and I think often punishing definition of, this is what it means to be a man. So if a man were to fit inside that box, they expect it to be dominant, emotionally restrained, tough, and always in control, right? Always at all times. And they also, I think, and again, Jason, if this is even counter something to the contrary, but I think oftentimes men are taught to equate vulnerability with weakness, right? So if you're vulnerable, you're weak.
Yeah.
And also they're taught to maybe equate their self-worth with their performance, being a provider, being the problem solver, being the protector, which I think in themselves, those roles are great, right? The problem becomes when it's not about the behavior anymore and it's becoming about the identity, right? So a lot of men identify as my self-worth, if I'm able to provide, this is where it lays. And if I can problem solve, I can take care, I can protect my family, which is great. But again, I think you brought in the example of COVID. A lot of men lost their jobs during COVID, and that was equal to losing their identity. And now what? Right? I don't have a job, I can't provide, I can't support. So resulted in this uptick of men struggling with depression, anxiety, and increased substance use. So I do think when we think about the man box and masculinity in this particular form, becomes something that men feel like they need to prove all the times to everybody else, to themselves, and they can never fail at it. And, even when they are struggling, maybe they are self-aware to acknowledge that they're struggling emotionally. I think they might feel like even the fact that they're struggling becomes a failure, right?
Yeah, and what they end up doing is they put on their mask, right? Because we all have to wear our masks. I have a client that I've been working with who doesn't fit into the man box. I mean, this is a guy who actually really enjoys Disney and loves the Disney princess movies and things like this, and yet he cannot say any of that because it doesn't fit into that box. And so what he does is he stuffs it in, and then he has no outlet. He doesn't connect with anyone because he's afraid of that judgment. And not only from men, but he's afraid of that judgment from women because he's afraid women are going to look at him and think, well, you're not really, a man, so why would I be interested in you? And so one of the things that he has struggled with is that lack of connection, that loneliness. And that's because of that societal pressure to fit into this is what it means.
Yeah, and I do think that when we have these expectations to fit into the man box, it cuts men off healthy emotional expression. It cuts them off being able to build those meaningful connections and relationship with people. I also think it tremendously limiting the tools that they can use, or the tools that are available or maybe even acceptable by our society, right? So many men, I think, you mentioned that already, are left with only like a few allowed ways to deal with distress and mental health challenges, whether it's anger. Yes, we don't like it, but it's okay. Socially, it's appropriate. Um, if you're not talking about it and trying to kind of internally process it, that's okay too. So we allow them to be silent. We allow them to numb themselves in whatever way, as long as they're not talking about this out loud or seeking support. Or we also are okay with them using distraction as a coping tool. And again, when I say I'm talking about the society at large. And I think that over time, the lack of healthy outlets and the emotional suppression definitely erodes mental health in men. And then we see those increased rates of depression, anxiety, substance use, suicide. So I think we circle back, the man box becomes a man trap, right? So now you trapped in that box.
Yep.
We also know, I talked about the research is actively exploring the man box paradox, but we also know that research consistently shows that men that allow themselves to be vulnerable experience significant mental health benefits. And so emotional openness, again, has been proven by the research, can lead to the reduced symptoms of, depression, anxiety, and can help a man build greater resilience. And I think also men who practice emotional expression and embrace vulnerability perhaps tend to enjoy more satisfying and more, I'd say, emotionally intelligent relationship with people, not only in their personal life, but also in their professional lives as well. And we know if you do the opposite, if you suppress your emotions, then we have all of those things, including physiological distress, and any other adverse health outcomes. Yeah, and I think, how can we help? How can we shift this? And we're going to talk about the strategies in a little bit, but I think modeling emotional openness, again, teaching the boys very young what it looks like, the healthy way of doing so, validating men's feelings, not dismissing them, not sweeping it under the rug, not minimizing their experiences and their emotions, and definitely learning how to use the language that is supportive and encouraging.
Yeah. I have a client that I worked with that it was great. So he's a father, and he came in and his worry was he wasn't good enough. That was his big concern. I'm not good enough. I'm not a good enough father. I'm not of this. And I asked him, I gave him an assignment to go home and just ask his children, do you believe I'm a good dad? And he's like, and I'm like, just try it, just try it. And so he took that chance and he was vulnerable and he went to them. And of course the kids were all like, no, you're great. You're wonderful. I mean, you're not perfect, but none of us are. And he said, he came back a week after and I followed up with him. I said, so did you do it? And he says, yes. I'm like, so how did it go? And surprisingly, he said, you know, my kids, it was a great experience. We were able to sit, we were able to talk with each other. They opened up, I was able to open up. And since then, we've kind of gotten closer to each other, and I love it.
Yeah, I know. I mean, that's a perfect example of how sometimes that internalized belief is not necessarily true, or it could be so far from the reality and what's actually happening. So I'm glad that you were able to help your particular client with that. And I know people are already voting because I fast forwarded to the next slide, but I wanted to ask a question about people witnessing a moment when a man shared something vulnerable, and um, that the dynamic in that particular moment has shifted in a positive way. Because I do think when a man, whether it's again on a personal level or on a larger level, such as maybe a leader or a public figure, shares something real, something really hard, I think it creates the space for other people to do the same. Kind of gives them permission, normalizes it. Because I've seen it how a man shared something vulnerable and the room softened. The trust became a little bit deeper. And I think the dynamic, you can't really like put your finger on it, but you can feel the dynamic changing in the room. It doesn't necessarily happen when women do that, but I've definitely experienced that personally when a man shared something vulnerable and personal. So is that your observation as well, or do you have a different experience?
Oh no, that's what I see quite often. It's interesting to me to hear like a man doing a presentation, and then you see him begin to get choked up a little bit. And all of a sudden that room will go dead silent as everyone just is anxiously awaiting, like, okay, what's he gonna share? And it does. And the one of the misconceptions that men have, right, is that big boys don't cry, that crying is a sign of weakness. And yet when a respected man does something like that, chokes up a little bit, sheds some tears, you go to any man and you say, so do you think he's less of a man now? And they'll say, no. That just it endears me even more to him. So that's one
Yeah.
of those things where you start going like, okay, it has a profound effect.
Yeah, it looks like we have the majority of people experience that primarily in their personal life, while some experience it in the public setting or professional life. And some I would really welcome it. And because again, that's just so powerful. And I think that poll exactly shows why this next section matters. Because yes, we know again, men are struggling. I know that the silence is real. I know the barriers are still there, but we're also starting to see something. And that something is that little shift. And I think it's the shift in the mindset, it's the shift in how younger generations talk about mental health, how they define strength, and how we talk about our emotions, how we talk about therapy, how we talk about connection. So I do think that maybe the tide is turning a little bit, and we are no longer where we were, 10 or even, 5 years ago, pre-COVID. I think where those topics were pretty taboo among men. So according to one of the recent studies that I've reviewed, it says that about 95% of men now recognize that mental health is as equally important as their physical health. And I think that notion alone, to me, is a major, a massive mind shift. And then when we look at the composition, right? So who are these men? Who are shifting the narrative here? Primarily, it's millennials and Gen Z. They are leading the way. They are definitely more open to therapy, more comfortable expressing emotions, and maybe more willing to support each other as men through the vulnerable moment. Is that your general observation that younger generation tend to be more willing to engage in therapy or discuss feelings or be more receptive to it?
Oh, very much so. I've actually had, especially nowadays with like teenagers, I've had moms call me up and say, hey, my son wants to come in. And so they're taking the lead, which is really great. And some of the, mid 20s and stuff are starting to go like, yeah, I need to come in. The interesting thing that I will say on the 95% of men say mental health is just as important as physical health. There's still that struggle that we're having where they'll say that, but it's for him, not for me, right? Oh yeah, mental health is really important and he needs help and he needs help. So there is still that they're recognizing it, but there's still that hesitancy to bring it toward me. The younger generation does seem to do better. And we see this, it's interesting if you do a family history and you say, is there any mental health, family history of mental health issues? A lot of like the older generations, they'll say, well, I think there was something there, but I don't know because we never talked about it. And
Yeah.
then you start getting to the next generation that's like, well, yeah, they had some little things, but we still didn't talk about it, but they did get help. And now, you say, what about like brothers and sisters, your generation? And they're like, oh yeah, and they can tell you more. So you can see over the generations how it is starting to shift.
Yeah, and I think that's pretty much my experience as well when it comes to generational, I guess, divide a little bit when it comes to mental health and even having conversation around it. But I also am observing, I think, some shift that is reflected in the content of social media, right? So now we're seeing more and more men that are openly sharing their stories. They're offering support, they're normalizing emotional wellness. And again, online is definitely a huge space for that. But also, I feel like in when we look at various athletic organizations, even schools, I think are starting to recognize and integrate specifically male-focused mental health programs. So I do think sort of the narrative is changing, and hopefully that trend continues. But I do think that also the real impact, when we talk about the real impact, kind of lives in a smaller individual moment, right? When one man opens up, um, the other men realize that they can do so too. So, right, again, whether it's just a very small circle, maybe it's just your partner or a close friend, or a wider arena. For example, we know a lot of famous people are shifting this narrative, and a lot of the shifts are happening not just in statistics, but in the personal stories that people share. And just think about Dwayne Johnson, right? So somebody who, like, if you picture him, your picture of masculinity, right? But somebody who demonstrates a lot of strength, a lot of resilience. But he's been very open about his battles with depression. And I love how he said that the most important thing you can do is to talk about it, and that you're not alone. But also a lot of other people, famous people, athletes, Kevin Love, Jonah Hill, they speak publicly about the anxiety, about depression, about the panic attacks, about going to therapy, and how that has changed their lives. But again, even smaller spaces, the support groups we have, the veteran support groups, the podcasts, even like personal relationship, right? So again, I think it's so encouraging to see this happening, and to actually to support this with the stories from your personal practice, that you actually seeing this in action, and the
Yeah,
conversations.
I love seeing the change, and I love seeing. And you're right. It's interesting if you get just one guy that's willing to take that chance. You almost see if there's a group of men around them, you almost watch them, and they will physically kind of, oh, and then it does open the doors. This is one of those things where one of the stereotypical, right? Guys get around the campfire and they're all sitting, and people think, oh, well, yeah, they're just telling long stories and drinking beer and stuff like that. But in reality, situations like that are prime opportunities. And often it does happen where that's where men will kind of let loose, open up, if they feel like it's a safe arena. And it's great to see.
Yeah. And I do think that that shift is not happening automatically, right? Just because it naturally happens. I think it happens because somebody's creating the space for it. And right. And that somebody could be you, could be me, could be anybody in this room, or anybody who is watching this webinar. So our last call about how to support men. We are transitioning in the last 5 minutes. We are going to talk about some practical ways. So I would like to hear from you. When someone you care about starts to open up emotionally, what is your instinctive first response? Yes, a lot of us go into that, like what I call fixer mode. We're trying to fix things because we love them so much, we care about them so much, we don't want to see them struggling, so we want to offer a solution, advice, where a lot of times that's not what's needed. A lot of times they just need somebody to create the space where they can be honest, connected, you know, have like the space that is created is conducive to healing. But yeah, so a lot of people try to offer advice and solutions. Some people say you just thank them and you just listen. Great approach. Or a lot of people just don't know how to react, and what do I do, right? Because again, we were never taught how to support a man in their vulnerability. So, right. So again, let's talk about the practical ways. That's what you can take with you. First and foremost, creating this non-judgmental space. And that means that we are leading with safety and openness and not solutions. It's hard. It's really hard to suppress that instinct that comes to us naturally, but you do need to resist that urge to fix or offer quick advice. And sometimes just listen, be there genuinely, be there patiently.
Yeah,
My
one
second,
thing, if I can, really
yeah,
quick,
sure.
Natalia, that people don't realize, right? Men tend to be known as fixers, right? We are the ones that tend to go in and it's like, okay, there's a problem, let's fix it. Well, if I'm a guy and I have a problem and I can't fix it, and you come in and start telling me how to fix it, that hits that masculinity as well. And it's like, well, good grief,
Mm.
I can't even fix my own problem. So and so, has to fix it for me. And so a lot of time there's resistance to that. And so being able to, not come in and say, oh, well, you need to do this. You ought to do this. it is that, you know, wow, that you always want to ask twice.
Yeah. Thank you, Jason. You broke up a little bit there for me, maybe, but I'm not sure if
Oh,
it was my internet. But I think we got the majority of what you were trying to convey. And I think it is a good point that most men already think of themselves as somebody who is supposed to fix their problems themselves. So it is not helpful to assume that role of a fixer for them. But when it comes to asking twice, you ask, how are you? And a lot of times it's just this habitual question, and most people will just answer on autopilot. I'm fine, I'm okay. But I do encourage you and invite you to follow up with a second, pretty sincere, how are you really doing? And then open that door for the men to share. They might do it, they might not, but you extended the invitation. And definitely respect their pace. I don't think we should be pushing emotional conversations. Again, some people, especially men, they need time to build that trust and to feel safe, to open up. And silence initially could be the part of that process. Again, boys were not taught how to express emotions, so don't expect them to be able to do so openly and readily on a very first try. Also, please be aware of the signs of distress in men. Again, we talked about burnout, withdrawal, irritability, increased substance use. Could be those quiet signals that they do need support, and they don't get. Oftentimes, men do not present with the typical symptoms as women do. And finally, normalize therapy, normalize mental check-ins. You don't have to wait for a crisis. Again, mentioning therapy casually, checking in with somebody to see if they're how are they doing, even if they seem to be fine, I think could send those powerful messages that mental health matters and that seeking help is a great option. So again,
and
words matter when we're in a vulnerable space.
and one of those things too with the asking questions, right? If we're saying not offering solutions. One of the best questions you can ask is, "What can I do to help you?" Because support you, but I'm going to let you be the one that drives it. I'm going to let you, it comes back to respecting their pace and letting them. And in the beginning, they may say nothing. And you go like, okay, well, just know I'm here for you. Just know
Yeah.
that if you need something, I'm here.
Yeah, absolutely. Definitely. And I know we're at time, so I'm going to fast forward the recap here, but also highlight that Tava Health has the collection of mental health resources. And Chelsea, if you could share the link in our chat, that anybody is welcome to go browse a lot of valuable information and a lot of insights that you can gather from here. I also wanted to thank everybody for being here, for spending the last hour with Jason and I. We are really grateful, and I think it was a great conversation. And thank you for your engagement and your participation too.
We do have some questions if we want to run over a little bit, but we don't
Oh,
have.
absolutely.
Okay, great. We have
I
like a
would love
hand.
to.
So the first one that came in are, is it only men that are silent about it? I think there are probably many people who struggle in silence.
With their emotion, with their mental health issues.
Yes, I think that's the implication.
Yeah, there are a lot of people that struggle. This isn't just a men's issue by any means, but this is just one of those where we're focusing on what men are experiencing as they do this. There are, I know quite a few others who suffer in silence as they're trying to be a good mom because they don't want anyone to, judge them that they're thinking this kid is driving me nuts. And so part of the, it's part of that is still that stigma, whether, we want to accept it or not, there's still quite a bit of stigma surrounding mental health. Tends to be more so for men than for women. But yeah, there's still people that suffer in silence.
Another one. How should we respond or react to a man expressing thoughts about self-harm?
So that one, it's if they're expressing, they don't have a specific plan or anything, I tend to listen. And then you try to just kind of understand that you're really struggling, aren't you? if there's any concern that they may do something, you immediately contact whoever you need to keep them safe, because that's the number one thing is that you don't want to have it happen. But one of the things, I had a client that called me out of the blue, and I picked up the phone. I said, "Hey," and he's like, "Hey, do you got a minute?" And I said, "Yeah." And he's like, "So I'm sitting in my car with a gun next to me." And I'm like, "Okay, what, having a hard time, are you?" And he says, "Yeah, I'm feeling just sad. I'm feeling like nothing's going right." And I sat there and talked to him, and he finally said, "Well, I don't want to do this." And I'm like, "Okay, well, you don't have to. And he's like, "Well, what do I do?" And I was actually able to talk him into, driving to his family's, his daughters, I think it was. And he drove to his daughters. They got in the car together, and he went to an inpatient place where he was able to kind of get stabilized. And his daughter was kind of like, he was opened up with his daughter, which at first she was kind of like, "Oh," but after getting help and everything, they have become even closer because she knows it's like, "Hey, Dad, you can come and talk to me." So that vulnerability again played a good role in helping him to understand that he didn't have to do it alone, and he didn't have to wait that long, right? That's one of the things, is you don't have to wait that long. But it's a lot of it is just listening and truly understanding, why are you here? What got you to this point?
Sure. Thank you. I think we have two more. Jason, to your point about straining familial relationships by going to the gym or finding any other seemingly quote unquote healthy outlet, how would you suggest to find that ideal, that balance?
So that balance is going to be different for each person individually and that family, right? The one thing that I encourage people to look for is, if you are starting to do something and it's pulling you away or it's causing problems in your family, then you're kind of getting out of balance. And so, if it's a guy and he's like, "Yeah, I go to the gym and I work out for 4 hours after work." And, next thing you know, his wife's sitting there saying, "He's never around. He's not here to help with the kids." That's where you start going like, "Hey, that might be a little out of balance. Can you find a balance where maybe you go for an hour one day, 2 hours one day, but then you're home because this is what's going on?" And so it's looking at all aspects. When anything is causing problems, you have to kind of start looking and saying, "Am I overdoing this?" It's the same for work, right? Somebody that's, "Yeah, I'm working, 16 hours a day." And it's like, okay, so that that kind of is, if you're working that much and your family's missing you and it's causing you strain and problems, yeah, the paycheck is great, but then it's causing problems in other aspects of your life. So you want to find that balance.
Wonderful. And I know we're over time. So thank you, everybody. Natalia, Jason, gorgeous job. Thank you so much for this information. Again, this recording will be accessible in the coming days. And I think with that, I hope to see you on future webinars. I think our next webinar is August. And if you RSVP to this one, you'll hear about the next one. So cheers and thank you so much.